Hey future RNs, welcome to ClearPath NCLEX. Okay, let's talk about myocardial infarction. This is, without a doubt, one of the most tested topics on the NCLEX, so we're going to make sure you absolutely master it. In this explainer, we're going to break down what is actually happening inside the heart, how you can spot those warning signs super fast, and of course the priority actions you need to take with MONA. Ready? Let's dive in.
You've probably heard this phrase a million times. Time is muscle. And when it comes to an MI, it is the absolute golden rule. What it really means is that for every single second that blood flow is blocked, precious heart muscle is dying. So as a nurse, how fast you act and what you know can literally save that muscle. This is where you make a life-changing difference.
So why are we focusing so hard on this? Because the NCLEX loves to ask those tough priority questions, right? Things like, what do you go first? Or which of these signs is the most concerning? This explainer is basically your boot camp for those high-pressure moments, so when you see them on the exam, you can answer with total confidence.
So here's our game plan. First, we'll get into the why of it all, the pathophysiology, then we'll talk about how to recognize those telltale warning signs. After that, it's all about your priority assessments, mastering that MONA protocol, and then we'll wrap it all up with a quick NCLEX drill to make sure everything sticks.
Okay, first up, pathophysiology. Let's really look under the hood here. Because if you can understand what's physically happening inside that heart, it makes everything else, the signs, the symptoms, the treatments, make so much more sense. It's the foundation for everything.
So what exactly is a myocardial infarction, or MI? Well, at its core, it's just a terrifyingly simple concept. It's the death, the official term is necrosis, of heart muscle tissue. And this happens for one reason. The heart's own oxygen supply gets cut off for too long. No oxygen, no life for those muscle cells. It's that simple and that serious.
I want you to think of it like a three-step countdown to a disaster inside the chest. First, you have an occlusion. That's when a coronary artery gets blocked up. Second, that blockage causes ischemia, which is just a word for the heart muscle being starved of oxygen. And finally, step 3 is necrosis, or actual cell death. And here's the number you have to burn into your brain for the NCLEX. After about 30 minutes, that damage is irreversible. The clock is ticking for real.
In this timeline, this really drives home just how critical speed is. Look at this. Within 30 minutes, you have irreversible damage starting. A day later, inflammation kicks in, and that opens the door to all sorts of nasty complications. And then by 2 months, you have scar tissue. And scar tissue doesn't pump. It just sits there, permanently weakening the heart.
Okay, so we know what's happening on the inside, but how does that look on the outside? What's your patient actually going to say to you or look like? This next part is all about connecting that internal science to the external symptoms.
Now, to help you remember all the classic signs, especially when you're under pressure during the NCLEX, we're going to use a really helpful mnemonic, CRUSHING. This little tool is going to be your best friend.
Let's walk through it. C is for that classic intense chest pain. Patients might say it feels like an elephant is on their chest. R is for radiating pain, usually to the left arm, jaw, or the back. U, this one's huge. It's unrelieved by rest or nitroglycerin. That is a massive red flag. S is for sweating, that cold, clammy sweat. H, hard to breathe or shortness of breath. I is for an increased heart rate and blood pressure, at least at first. N is for nausea and vomiting. And G, this one is so real. G stands for going to be anxious. That feeling of impending doom is a very real, very terrifying symptom.
Now listen up, because this is a huge NCLEX tip. Not everyone is going to walk in with those classic signs. You have to be on high alert for atypical symptoms, especially in women, older adults, and patients with diabetes. You know, they might just complain about being super tired, or say they feel like they have the flu. And patients with diabetes can even have what's called a silent MI with no pain at all. You have to recognize these atypical signs to catch a heart attack that others might miss.
Okay, your patient is showing the signs. You can hear that clock ticking in your head. So what do you do first? This is where your clinical judgment really shines, and it's exactly what the NCLEX is designed to test. Let's go through your priority actions step by step. Here are your first 4 moves, and they have to be in this order. Step 1, always and forever, is your ABCs: airway, breathing, circulation. Can't do anything if those aren't stable. Step 2, get a full set of vital signs. Step 3, assess their pain using PQRST. And step 4, this one is non-negotiable. Get a 12-lead EKG immediately.
Do not pass go. Do not delay this step for anything.
So you've done your assessment, you've got the EKG, now it's time to intervene. The core initial treatments are famously remembered by the acronym MONA. Let's make sure you have this down cold.
All right, let's break down MONA. Now, here's the thing. We all remember the acronym MONA, but the order we actually give the medications in is a little different, and it's all based on what's safest and most effective. So think OANM. First up is oxygen, and this is a biggie. You only apply it if the O2 set is less than 94%. Got it? Next, aspirin. You're going to give a chewable 325 milligram tablet, and that's to stop that clot from getting any bigger. Then comes nitroglycerin, which helps open up those blood vessels. But, and please remember this for the NCLEX, you absolutely have to check their blood pressure first. It can cause major hypotension. Finally, if that crushing pain is still there even after the nitro, you'll give morphine. And of course, you'll be watching for respiratory depression. So to recap, we remember MONA, but we act OANM. That's a huge NCLEX tip right there.
Okay, you have got the knowledge. Now it's time to put it to the test. Let's do a quick NCLEX practice drill to really lock this information in. I'll read the question. You can pause and think about your answer.
All right, first one. A female client comes in reporting extreme fatigue, shortness of breath, and some lower chest pain. She says, "I think I just have the flu." So which action should you, the nurse, take first? 1. Give her an antiemetic. 2. Obtain a 12-lead EKG. 3. Encourage her to rest. Or 4. Check your temperature.
And the correct answer is number 2. Obtain a 12-lead EKG. But why? Because those are textbook atypical signs of a heart attack in a female patient. Your absolute number one priority is to rule out a cardiac event, no matter what the patient thinks is going on.
Okay, here's the next one. A client with crushing chest pain is ordered sublingual nitroglycerin. Which assessment is absolutely essential for you to do before you give that medication? Is it 1. Pain level, 2. Respiratory rate, 3. Blood pressure, or 4. Potassium level?
And the answer is, of course, number 3, blood pressure. This is a massive safety check. Nitroglycerin is an incredibly powerful vasodilator, meaning it can bottom out a patient's blood pressure. Giving it without checking that BP first isn't just a mistake, it's dangerous. Seriously, great job on those questions. You know, every single time you work through a practice question, whether you get it right or wrong, you're building that clinical judgment muscle you need to be a safe, amazing nurse and to crush the NCLEX. You're doing the work.
So before you go, I've got a question for you. Out of all the letters in the CRUSHING mnemonic, which sign is the one that really sticks in your mind the most? Drop a comment below and let me know. And that is a wrap on part 1. You've built a really solid foundation today. Now, in part 2, we are going to dive even deeper. We'll cover post-MI medications, scary complications like cardiogenic shock, and the absolute must-know patient teaching. You definitely won't want to miss it.
Thank you so much for studying with me here at ClearPath NCLEX. If this explainer helped you feel a little more confident, do me a favor and hit that like button. And be sure to subscribe for more high-yield content just like this. Oh, and hit that notification bell so you never miss the next game-changing NCLEX tip. I'll see you in part 2.